I am Dr. Smurti, senior diabetologist practicing at Nellore. We are having a diabetes and endocrine clinic, and we are in practice since more than 30 years. And this is the referral hospital for diabetes, and this is a research center also. And we have separate research wing and biochemistry wing and patient education and the management department. So I am heading this hospital since more than 30 years, and we have registered around 1.5 lakh patients. This is one of the district headquarters in Nellore in Andhra Pradesh, and we have been seeing around 100 cases per day, and we are involved in so many studies and diabetic foot study, and recently we are doing one insulin study also, and these type of activities. And we have separate patient educationist who will be counseling the patient regarding diet and the drug usage and other things. We have 20 beds patient hospitals, 20 beds also in patient wing, and where we will be admitting the patient for various reasons and controlling them and discharging them within 1 week of time.
How does Imeglimin fit into your regular practice with the current landscape of T2DM treatment options? Kindly share your experience.
So Imeglimin is one of the good molecule, and where it is a novel approach for the management of type 2 diabetes patient, especially targeting the mitochondrial function, which is distinct from the other traditional diabetic drugs, where they will be controlling sugars and they will be targeting insulin resistance or insulin secretion, those things. Whereas the Imeglimin is totally, it is targeting the mitochondrial function, so that it is able to enhance the insulin secretion and as well as the sensitivity, and it inhibits the hepatic gluconeogenesis, and it supports the beta cell function, and which is a valuable addition in the treatment of type 2 diabetic patients who are not achieving adequate control with the drugs what they are using.
In what specific patient population do you see the greatest benefit of using Imeglimin?
Imeglimin is actually beneficial for patients who have uncontrolled hyperglycemia with multiple metabolic dysfunctions, as those with significant insulin resistance, or those with higher prone for diabetic complications. So Imeglimin also offers a promising option for patients who are experiencing adverse effects like gastric intolerance and other problems like diarrhea, bloating with metformin. So in these type of cases, Imeglimin is another option as a glucose lowering agent who are addicted to the metformin therapy or problems with any other anti-diabetic drugs.
How does Imeglimin compare to other hypoglycemic agents in terms of safety and efficacy?
So I have used Imeglimin in more than 1,000 patients in my practice, and in my practice and experience, using Imeglimin individual or as add-on therapy reduce the dose of existing medications or reduce the dose of the insulin also. We have plenty of patients who have shown improvement in glycemic control without experiencing significant side effects like gastrointestinal issues or hypoglycemia. And usually we give Imeglimin 500 milligrams 2 times a day after food. It has a proven effective in reducing the need for other diabetic medications, and even sometimes we can stop the basal insulin doses also or reduce the insulin doses also in some cases. Around 0.6 to 0.8 HbA1c reduction is also observed in the patients who are already using Imeglimin. Its dual action on insulin sensitivity and insulin secretion, along with its mitochondrial mechanism, provides effective blood glucose control. So most important part is to highlight the imeglimin ensures glucose-induced insulin secretion as well as it protects beta cell and preserve the beta cell mass. This is very important. Where the sulfonylureas will squeeze the beta cells and increase the insulin secretion independent of the food. So imeglimin is safe when compared to the sulfonylureas, and the hypoglycemia is very, very less. And moreover, like metformin, imeglimin reduces the hepatic gluconeogenesis and increases the glucose uptake in muscles. So insulin resistance will also be reduced. It is useful in secreting insulin from the pancreas as well as the glucose uptake from the muscle or the peripheral tissue. Additionally, imeglimin has shown synergistic effect with combined with another anti-diabetic drugs, making it is a versatile addition to the existing treatment for diabetes mellitus. So people who are not responding to the conventional treatment, where you are planning to add insulin for those group of the patients, if it is safe for you, you can try imeglimin for the time being, and you can see what are the HbA1c levels. But within 3 months, you will get a very good response with the existing therapy with the add-on to imeglimin.
In recent time, imeglimin sustained release formulation with Indian study has been launched in India. What is your opinion on that?
So clinical studies indicate that imeglimin sustained release has a better safety profile, like with lesser GI side effects, with the tolerability and efficacy also compared with metformin sustained release. As per the Indian study, imeglimin SR, there were 50% lesser gastrointestinal side effects when compared to the effect of the metformin SR, whereas efficacy was on par. So in some patients where the pill burden you feel, patients who may require 2 times a day imeglimin 500 milligrams, in those group of the people, imeglimin SR is also useful. And I have tried some of the patients in my group of the patients, and they are doing well with imeglimin SR, and it is also as effective as 2 times a day plain imeglimin. So I have used it in some of my patients, and I have seen benefits like better tolerability and able to reduce the dose of the metformin from 1000 to 500 milligrams. Even though patient is taking metformin, you can add on imeglimin as a first line or second line drug. And patients who are allergic to the metformin, you can try imeglimin as a first line drug also. You can see the reduction in the HbA1c levels.
How does the mitochondrial targeting mechanism of imeglimin influences its clinical use?
So mitochondrial function is a crucial for all cellular energy production and metabolic regulation. In type 2 diabetes, mitochondrial dysfunction is a common underlying issue because the cellular energy will be reduced in the type 2 diabetes that contributes to the insulin resistance and impair glucose metabolism. So targeting the improving the mitochondrial function, imeglimin addresses a fundamental aspect of the disease, helping to restore the normal metabolic process and increasing the cellular energy for the beta cells. So this unique approach is only aids in lowering the blood glucose levels, but also has a potential to improve the overall metabolic health and reduce the complications associated with metabolism. As the imeglimin is addressing the mitochondrial function, so where the mitochondrial dysfunction you see in type 2 diabetes, and the cellular energy production is with the mitochondria with imeglimin is useful in producing the insulin secretion from the beta cells.
What are the key safety and efficacy findings from clinical evidences on imeglimin that clinicians should be aware of?
Number one is lesser gastrointestinal side effects. When compared to the metformin, we are seeing hundreds of the people are unable to tolerate with metformin treatment because of their gastrointestinal side effects like diarrhea, bloating, indigestion, and the patient is not able to tolerate the metformin I have plenty of examples in my patients who are unable to tolerate metformin. So in those type of the cases, that type of gastrointestinal side effects are not observed with imeglimin. And number 2 is better tolerability. Patient is able to tolerate the imeglimin 500 milligrams 2 times a day, or imeglimin SR preparation is also patient is able to tolerate. So when compared to the metformin, imeglimin scores over less gastrointestinal side effects and better tolerability. When it comes to the efficacy, this is ideal for add-on to the existing type 2 diabetes therapy with the reduced dose of other medications as well as insulin.
Do you believe that imeglimin has the potential to change the future landscape of diabetes treatment?
Imeglimin is a medium type of drug. What already I told you, 0.6 to 0.8 HbA1c reduction has been observed when you give imeglimin, but it is significantly impact the future diabetes treatment by providing the new mechanisms of the action which complements the existing therapies. Its benefit in improving the mitochondrial function, which is very, very important. This is the only drug which improves the mitochondrial dysfunction, and it will give the favorable and potentially reduce the diabetic complication, position it as a promising option for more comprehensive diabetes care. As the research continues to unfold, the imeglimin may become the cornerstone in the management of type 2 diabetes, particularly for patients with complex metabolic needs. So we are trying imeglimin instead of metformin as a first-line drug in the newly detected diabetic patients who is a little bit obese. This is the ideal drug to start as a first line, but according to the ADA guidelines, still metformin is the first line of therapy. When the patient is unable to tolerate the metformin therapy, we are trying imeglimin as a monotherapy, because without adding any drug, you are giving imeglimin 500 milligrams 2 times a day or imeglimin SR, and we are seeing very good results. At least you have to wait to 2 to 3 months so that you will get the good response and good results, and patient is able to tolerate this drug well. So imeglimin's favorable safety as well as the tolerability and efficacy make it a valuable option in the comprehensive treatment plan for type 2 diabetes mellitus. So the specialty with imeglimin is you can give it as a monotherapy, or you can add this one with gliptins, imeglimin plus gliptins. If the patient is able to tolerate metformin, you can give gliptin, imeglimin and metformin, or you can add on to sulfonylurea, or you can add on to insulin also. But only rider is this type of the treatment we don't choose in patients with chronic kidney disease. In CKD, usually we avoid metformin as well as imeglimin also. So in those cases, the treatment is entirely different. But when compared to the 90% of the population of the diabetic patients, imeglimin is one of the choice in controlling the diabetes, as well as the future will also be bright for imeglimin, where it has a special unique action on mitochondria, where the cellular energy will be increased in the beta cells, so that insulin production will be increased, so that good control of diabetes you can achieve and you can prevent the possible coming complications.